thank you, everybody. Again, I said it in the last lecture, I'll say it again. Thank you for still being here on Sunday afternoon. And I see many people smiling, so not only just being here, but being here energetic makes me very, very happy. So thank you guys for coming. I know many of you are familiar faces from the last lecture, so we didn't repeat the whole exhaustive and slightly painful to hear from me bio, but just as a brief who I am. Right now I'm a veterinarian with the Shelter Medicine Services for the ASPCA. So in that role, I don't do clinical practice anymore. But in my past life, I spent almost 11 years at the Animal Rescue League of Boston, doing clinical practice in the shelters, doing shelter medicine. And so it is largely through that work, although certainly through my ongoing interactions with our shelter partners and our internal programs, that this is a topic that I really love and I'm really excited to talk about because it's something I feel very, very passionately about, and I think it's a growing trend in veterinary medicine and certainly in sheltering to really be mindful about the way that we are interacting and handling our animals, and it's just such a game changer. And I'm going to give full credit where credit is due. Dot Baisley is sitting in the audience and helped teach me this stuff, so it's an ironic role reversal here, along with Jessica Wright, who is one of our the lead technician at the Animal Rescue League of Boston used to be, and so you'll see some videos made by them. But to give credit, they very much taught me, and then I had to be sort of the old dog that learned the new tricks from them. But they created a convert, and so I'm happy to then pass the message along to you guys. So full disclosure, though, this is a talk about gentle handling that is not coming from a behaviorist. I am a shelter veterinarian. But I hope that comes with its pros and cons. There certainly might be some expertise that I don't have, but I do have sort of in the trenches, implementing this, learning to do this when this was not how I originally learned to handle animals in veterinary school and in my past, kind of work, either as a technician and doing stuff. And so hopefully that helps to relate to some of the challenges that you may have if you are already implementing this at your shelters or if you're learning this for the first time. So that's my caveat. My other caveat to this is that this is an hour on gentle handling. We do have some lovely demo models that I'm sure you have noticed in the front. It almost looks, from my vantage point, it's like an inquisition for everybody sitting there. But obviously we're not gonna, you're not gonna learn all the techniques in an hour without real animals. And so my goal with this hour is for this to be sort of a primer, an introduction to the why, which I think to a large extent is preaching to the choir, but we'll go through the why, and then also an introduction to some of the techniques, but I'll also help point you in resources to learn more. But hopefully this gives an introduction for those that are new to it, or for those that are really looking to expand the way that you're using gentle handling in your shelters, in your clinics. Are there any veterinarians in the audience? Is this all staff? Okay, perfect. I expected staff and volunteers, so I'm glad to talk to you guys because it's so applicable in shelters, and so excited to talk to everybody about this. So what we're going to cover today, I kind of went over this a little bit, but we'll go through some of the basics for the why. So this might be a review for many of you. I think it depends on kind of when you started your career. Again, this is becoming more the norm, but for those of us that are like me and started a little while back, this was not the norm when I started in my veterinary practice and in my shelter medicine career. So talk about what and why we should do this, and then start to delve into the how. And again, this is not going to be an exhaustive how-to. I hope I'll give you some techniques that you can actually walk home with today. But really talk a little bit about some of the basic tenets of the how, so you kind of know how to grow from there with how you're using gentle handling in your shelters. I'll go through some tips and tricks, some of these from interacting with colleagues, some of them from my own sort of lessons learned as I kind of developed this skill and learned how to implement gentle handling in my practice. I'll give you, like I said, some resources for how to learn more. There's some pretty big, I think many of us are probably already familiar with them, but there's some pretty prominent programs to learn, to delve into more detail. And then we will address these creatures in the front. These are our cats for the day as a heads up, as a teaser. So that'll be our last thing. We'll do just a tiny little bit of hands-on stuff with gentle handling. All right, so let's step us back and talk a little bit about what do we mean when we say gentle handling. And I think there's a lot of different terms that are used synonymously. I think certainly low stress handling is one that is also very commonly used. fear-free handling. Some of that comes with, we'll talk again at the end about the resources, some of that comes from which program you might be learning from. So gentle handling is kind of a brand-free way to say it. But basically, it's the same basic tenets that we're talking about. And some of it is stuff that we all kind of do inherently, but it's really expanding on that to make it an all-encompassing way that we're handling the animals in our care. So the basic tenets, it's any handling that is done in a way that minimizes fear and distress for our animals in our care. So sometimes this is going to involve no handling. It might be that you can accomplish what you need to do without handling that animal, or you can postpone what you need to do until you can come up with a plan to enable handling that animal in a gentle and low-stress way. It's applicable at all points of interaction. I'm a veterinarian. Veterinarians are notoriously the worst at changing and learning new things in terms of what others are telling us to do. And so I certainly fall into that bucket of some of the more resistant people, but it can happen. You can do it. You can do it as part of the veterinary process. You can do it whether you're an animal control officer, whether you're in the shelter working with the animals, whether you're doing intake. Every point along the way, this applies. At the ASPCA, there's the group that teaches gentle handling within the organization is actually some of the technicians from ASNA, which used to be Humane Alliance. So that's our high volume spay-neuter clinic. So they're doing hundreds of animals a day for spay-neuter. They need to get them induced and get surgery started, but they have implemented an entire gentle handling, basically that is across the board. That is the policy for that program, and they can do some wonderful things. So I think if they can do it, all of us can do it, and I'm going to talk a little bit about some tips and tricks to make that happen. And it may include tools. Certainly we're all familiar with muzzles, the cat gloves, towels, as you can see, are one of your greatest friends with gentle handling. So it may include tools, and often includes tools. It may include pharmaceuticals. And in the context of this track, I'm not going to delve into the pharmaceuticals because those are prescriptions and it does involve sort of veterinary prescribing of the pharmaceuticals. But certainly we'll touch on it a little bit more in depth later to provide you guys with some background. But pharmaceuticals are often a way that we can help with gentle handling if we can give some mild sedation or reduce some of the anxiety for the animals in ways, in whatever way we can, taking a multimodal approach, a holistic approach to how we're interacting with the animals, and using all of the tools at our disposal. It's not just cats and dogs. Karen's in the audience, right? Showing a picture of us. Not that I'm claiming that my handling of that bird is perfect. It's certainly not. But I just put that picture up there to reinforce. We're going to talk about cats and dogs today. Because it would be beyond the scope of the lecture, and to be perfectly honest, beyond the scope of my knowledge, to talk about all the ways that different animals that we as human beings care for can be handled in a gentle way. I would actually say in some ways, I think us with cats and dogs are a little late to the game, because I think for some of the, particularly when we talk about zoo animal, there's some necessity born from the size of the animals that people have been caring for, that they have to, for their own safety, come up with gentle handling ways to do it. But certainly there's example for if any of you have ever heard or read anything by Temple Grandin. She's amazing and has been a big proponent for gentle handling and the whole way we interact with farm animals, particularly at slaughterhouses. In the equine world, if you search gentle handling horse, there's all sorts of lessons about getting horses into trailers in gentle ways. So it's being done with all the different species in our care. But with that said, we're going to focus in on cats and dogs because that's the majority of what we're dealing with, and just to limit the scope of what we're talking about. So why? So that's a little bit of what it is. Why should we do this? Well, many of you have probably been exposed to the 5 freedoms. 5 freedoms, actually, in the context of the previous slide, comes from a Farm Animal Welfare Council. But it's basically, these are the things that we need to be focusing on for the animals in our care as responsible tenants for the animals that we are caring for, to provide them with these freedoms. And gentle handling certainly falls into that. When we are handling our animals in a way that causes them fear and distress, that is contributing to, fear and distress is right on there as one of the freedoms. But even some of the other ones, pain and injury and disease. If we handle our animals in a rough manner, sometimes that can actually be pain-inducing. And we have to accomplish certain things in our field. and we have to accomplish certain things for the betterment of the animals in our care. But for the vast majority of things that we need to do with the animals, we can do it in a way that helps to provide these freedoms to them as best we can and reduces the fear and distress that they're feeling, and certainly any pain that they're feeling from the way that we're handling them. So let's delve a little bit more into the why. I think that reducing the animal stress is the obvious, right? That's kind of what comes to mind, of course, and that's obviously an incredibly important component of why you would implement gentle handling, both for yourself and as a protocol for your shelters that you work with. But there's a lot of other side benefits to gentle handling that don't necessarily have to do with that in the moment reduction in animal stress. I think one of the biggest ones is the reduced staff stress. Staff, and when I say staff, I of course mean staff and volunteers, because it's anyone that is tasked with doing this stuff. As somebody that was in shelter medicine practice for a long time and doing the work, there is nothing cruddier than feeling like you're not doing the best for the animals that you are caring for. It's an incredible source of stress to feel like you're causing more harm than good. And I think gentle handling is one small way to help reduce that stress. If you don't feel like you're torturing that cat when you pull it out of the cage, or you come away from whatever you've done to do to that dog and they're still wagging their tail, those are ways that can just be small elements of gratification to reduce your stress. And that's certainly not for nothing, and that's a nice positive spiral. Because then the less stressed we are, the more we can continue to handle the animals in our care in a calm manner that is gentle, and so on and so forth. And it just creates this great positive spiral and helps make our own work more pleasing. It also can, believe it or not, be faster. Maybe not immediately, but with good training, it can actually be faster. And we're going to delve a little bit into that into the next slide. Improved public perception. So certainly, there are some members of the public, like our foster caregivers, who really are actually part of our organization, who are going to see this in a very direct way. But the public at large, the people that are coming into our shelter as our clients from all avenues, are watching us. They see what we're doing. And a lot of the stuff that we do is happening behind the scenes, but there's also a lot of the stuff that we do that is happening in front of people. And somebody walking in off the street may not know anything about gentle handling or that terminology, but they can tell when an animal seems more comfortable. And that has a lot of positive ripples. And so having these gentle handling techniques can help to improve our public perception as an organization, as people, showing that we're really going the kind of extra mile for the animals in our care. I think certainly when you go through trainings that are geared towards veterinarians in private practice, that comes up where you've got the animal's owner right there with us, but it definitely applies to us as well in shelters, because we've got people right there that are invested in these animals and really notice when those animals seem happier in our care and when things are going more smoothly. Improved adoptability. I think if we have an animal that every time, especially if it's an animal that requires multiple things, needs to be medicated every day, requires stuff like that. If every time somebody comes to their enclosure, they're having a negative experience, it's going to reinforce negative behaviors. Whereas if we can try our best, and we're not going to be perfect at this, cats are going to be scared of us sometimes. Dogs are going to be scared of us sometimes. But if we can do our best to make sure that our interactions with the animals in our care are positive, then that's going to help to reinforce them considering people that are coming to look at them from as adopters in a positive way. They'll come to the front. They won't hide, kind of in their bed. And it's not going to be a perfect solution, but it helps. And so it can help to improve adoptability. And it also can help to set the animal and the adopter up for success. I think the most clear place where this applies is with our puppies and our kittens. It's a big topic within veterinary medicine because, again, vets are the worst offenders for not necessarily picking up on trends and thinking holistically about the animals in our care. But if we can get especially these most impressionable puppies and kittens to where they don't perceive these things as negative. And a lot of the stuff we do in shelters, whether it's being done by a veterinarian or not, applies to ongoing veterinary care. We're giving them medications, we're giving them vaccines. All of us are doing it, not just the veterinarians, but it applies to down the road when they are getting, to when they are getting veterinary care. It just helps to set them up for success, that they will better tolerate that down the road. And it's not just the puppies and kittens. Certainly we can help to set that stage even for adult animals that we're caring for, just as one small part in their life that helps to set the stage for positive interactions down the road for them. So let's circle back to that efficiency thing, because I think when I've talked to colleagues about this topic, or honestly, when I've worked with colleagues and we were implementing this, I think the concern is that, well, this takes longer. That's all well and good. That's great. But if I just scruff this cat like this real quick, it's only going to take a minute, and that takes way too long, and I just can't. Like, I've got too busy. I've got too much to do. And when you're first implementing gentle handling on a widespread basis, that might be a little bit true. It might take you a little bit longer to do these new techniques. It's just like anything. It's new. It just takes longer to get the hang of. It takes longer. We're going to talk about some tips and tricks of ways you can help that process and make it fast. But ultimately, once you get good at this, or once you become more comfortable with this, if your animal is more compliant, there's going to be less struggle, and that's faster. It is faster to get the heartworm test on the dog that is not fighting you, and it doesn't take 4 people, and it's not a big thing. It's faster to get the blood draw on the cat, that you're getting it right away, and you're not struggling and fighting and having to call in the extra person to hold the send down. And so ultimately it's faster, but we'll talk about ways to help in the beginning, because there's a little bit of a learning curve, just like with anything. And as I said before, I think there's certain groups in the shelter, certain people, certain roles that I think more readily embrace this than others, because we just have different interactions with the animals. So veterinarians are slow to embrace this, I think, because it's like, well, we got to get all this stuff done. We got to get, all these surgery patients done. And you're not necessarily doing gentle handling in the middle of surgery, but as I talked about in terms of like inducing the animals for surgery, getting them their exams, it is doable in that context. If Humane Alliance can do it, we all can. At intake, I think, is a big one where you've got a lot of pressures on you to move fast when you're in intake, because you've got other animals waiting to come in. You're counseling the surrounding. You've got a lot that is going on. And so making that intake process go fast is important, but it's doable. It's doable and it's important, I think, in terms of, I think it's one of the most important steps to try to do this. So we're, again, setting that animal up for success while they're in the shelter. And it is applicable for work in the field. When I was at the ARL, I wasn't often called to go out on cases, but we did get a number of kind of larger cases, kind of overcrowding, hoarding situations. And I remember one in particular where I went out with one of our rescue agents who sort of functioned in a similar capacity as an animal control officer just for the private organization. And we were it was a Chihuahua hoarding case. And so there was a whole bunch of Chihuahuas that had not been socialized, that were in cages, some of them in the basement. Like it wasn't a great scene. And it was like, what a nightmare, right? They did not want us to be anywhere near them. But I think to her credit, I'm not giving myself credit for this, but to her credit, we were able to accomplish that with a lot of towels and with low stress handling. Were those animals still stressed? Of course they were. They were under-socialized. They're in this hoarding situation. Strangers are coming in. There's a lot of people around. But we could take measures to make it better. Some of it with the actual handling, some of it with the way that we controlled our own kind of volume and the way we were approaching the animals. But it was doable even in that scenario. And so that certainly applies to other situations when you are in the field, that this can be accomplished, even with some of our more challenging animals to handle. So there's some basic tenets to the how that kind of apply across the board. We're going to delve into a little bit of specifics, differentiate a little bit for some techniques that tend to work for large dogs versus small dogs and cats. But we've got some basic tenets that are applying. And again, not a behaviorist. Those are kind of coming from, there's some legitimacy to these terms, but they're coming from my standpoint in terms of how I look at these and how I've categorized them. So a big one is distraction. I think this is probably one that is relatively intuitive, and especially when we talk about our large dogs or our goofy dogs, using food, using treats to distract them. Basically having the animal not really focus, not pay attention to what we're doing because they're distracted by the positive thing. toys, petting even, can be a distraction to so that they don't realize it. And when I was coming up with this slide, I kept thinking, so in my household right now, those of you that were in the last lecture saw a picture of my geriatric cat who I did a poor job raising as a singleton, so he is not easy at the vet. So the techniques that work for him are very different, and we'll talk about those, than the techniques that work for my 9-month-old pit bull puppy, who is everything that you would expect from a 9-month-old pit bull puppy. Like, and so when he goes to the vet, distraction is incredibly useful for him. Like if you've got a toy squeaking in his face or like, cheese, and we'll talk about some techniques for this, he doesn't even notice that the shot went in. And in fact, when he enters the veterinary clinic, like he is too happy. Like we have to go the opposite direction and kind of control because he loses his little mind because he's so excited. So for him, distraction is perfect. Like that's great. And that's setting the stage for positive down the road. For my 14-year-old cat, he might take a treat sometimes, and we'll talk a little bit about how you can try to use that for cats. But for him, it's reducing that negative stimuli that really help. And I think that covering, and you notice that our cats have towels. Towels are such an amazing tool. And so covering up the animal can make them feel more secure. You're reducing the stimuli of their environment by that covering, and whether that's their head or not, we'll talk a little bit about some nuances. But covering them up, keeping the noise level low. It's scary if there's like shouting. I mean, it's scary for people to have shouting around us. And so keeping the noise level low, not just of us, but of the other animals. Sometimes it's unavoidable. All of us have different setups. I certainly did not have a perfect setup when I was at the ARL in terms of where we were doing the exams. There's a hallway, people were going by, there would be dogs going by sometimes. So it's not going to be perfect, but just having a mindfulness about what sounds are happening and what might be scary. Our exam room was right next to the kitchen. And so sometimes people would be doing dishes and like dishes would bang. And that's something that we can actually avoid, but makes a big difference for that, particularly when we're talking about the fearful animals, if we can reduce those negative stimuli. Reducing traffic in the area. Again, our setups are what they are, and so we can't always be perfect with this. But if your intake area, as I've certainly worked with at places, if your intake area is right in the middle of where everything is happening, the officers pull the animal off the truck, they have to do everything right there while everybody is walking around, and there's dogs walking around there too. That's stressful for everybody. And so trying to help reduce the traffic and the busyness in where you're doing things as best you can. And you just have to work with what you have. And sometimes that means if it's safe to do so, doing things outside, if it's a scenario where that's safe to do, somewhere where there is less happening. The other thing that is on a much more kind of smaller scale, but is important, is reducing the negative stimuli that comes with sort of inconsistencies in the way that we're touching the animal. So if you think about it, if you are I really like feline medicine. I'm feline, so I tend to talk about cats a little bit more, so apologies for those that are super dog people in the audience. But if you think about it, and you're a cat, and you're in a shelter, and you don't know who we are, and you're just like, you're hunkered down there on the table, and then every once in a while somebody touches you, and you flinch, and then it's quiet for a while, and then somebody touches you again. And that's just this constant repetitive stress that's happening. Whereas if we maintain a steady pressure with our hands, that can actually reduce negative stimuli. Our hands are still there, but it's not this sort of unexpected negative stimuli that they don't know how to predict. So there's all these little things that are along with this basic tenet of reducing negative stimuli. And certainly there's more that I didn't list and other things fall into that. And then counter conditioning is more of a behavior term, and that's when we're really switching an event that is negative to something positive. So that's what's happened with my dumb little puppy who thinks that, the vet is great because we've taken a scenario that is negative in many ways. He is getting restrained in a weird way. He is getting vaccines, but counter-conditioned it to be positive for him. It was easy because of who he is, but that can be, it's something that may or may not apply for us in our worlds. It might be that we just set the stage for this down the road with our very limited interactions, but it might also be that we have some animals in our care for a longer period of time. Say we've got, a law enforcement cocker who's got nasty ears, and we're treating that but we're holding that animal for a period of time, we can work with them to create a positive association with handling of the ears. Those sorts of scenarios can happen. So it may or may not be something that we're doing all the time, but it is an important part of gentle handling. That's what we're talking about, when we talk about the zoo animals where they've kind of trained they've used training and counter conditioning to help, kind of work with those animals. We can do that in our world as well, and it may or may not be applicable depending on sort of how long that animal is in our care. So let's talk a little bit of specifics. Again, this is more of an intro, this is more of a primer into gentle handling, but let's delve into a little bit of specifics. And as we talk specifics, some of them apply to everyone, some of them apply more to other species than others. So let's talk a little bit about our large dogs. I tend to be more of a cat person, so this is where I struggle. This is my challenge with these large dogs. Food is obviously a big one. Food is a major distractor. I think if you have a large, goofy dog that is not taking food, might be a red flag for you. That animal is probably more stressed than what you think, as long as they're healthy. But certainly for a lot of our large dogs, we can use food, like I do with my puppy, to distract them. One thing with the large dogs, and this applies to all of our animals, but I think we don't always think of it with the large dogs. We have a really active dog coming into the room, and it might be our intake room, for me, my exam room. When they come in there, sometimes the tendency is to let them run around, and they're sniffing, and they're having, and they might be happy, but oftentimes it also is making them a little bit aroused in that they're getting a little worked up. And that might be because of some underlying anxiety and fear. Oftentimes it is. Even if they're happy dogs, they're still in an environment they don't know, and they're still experiencing some element of fear. And so keeping that control can actually be helpful. It doesn't mean there aren't contexts where you wouldn't have that dog running around and playing. It doesn't mean they're controlled the whole time they're in our care. But if we're about to do something with them where we need to handle them and they need to be restrained, not letting them run around and get sort of amped up, even if it is a friendly animal, can actually really help in the long run. And along those lines, once you get to that restraint portion, so you're keeping them on a leash while you're getting stuff set up or while you're doing, when you get to that restraint portion, you can use your body really wisely to help continue to maintain that control. As doing an exam on a large dog, I would oftentimes position my body in a way that I'm kind of holding with a stethoscope, but also using my hip to sort of keep them still. And I've got a couple of videos that show Dot doing it. She's right here. She could probably demo it too, but that how you can use your body with large dogs. And I think some of it is with your arms, but we're a pretty female-dominated field, and I know for me, my bottom half tends to be the stronger and the bigger part. So we can use our lower half too to help control our large dogs in a ways that gives us more control and is also gentle handling. The other thing, I am actually a pretty big fan of muzzling when I feel like it's indicated. I'm not necessarily a proponent of muzzling everybody. I have worked at a clinic where they muzzled everybody, and I think for some dogs that just makes more stress than it's worth. But for a lot of dogs, and some cats, I think that it can actually be very helpful. So for some of them, it helps to calm them down, but I think even more so, it helps to calm me down. Because if I know that there's at least a little bit of a protective barrier from them biting me, it helps me feel a little more comfortable in my movements and my handling with them. You don't want to trust that the muzzle is a foolproof solution to you not getting bit. You don't want to be cavalier just because you have a muzzle on, but I think it can actually be a really useful tool. And I think if you go to it sooner rather than later, it can be an even more useful tool as opposed to a stress-inducing tool. And there could be a whole separate lecture on muzzling, and I'm happy to take questions at the end about which muzzles work best and so on and so forth. But just know that I do think they can be a valuable tool. Even when you're talking about gentle handling, you're not necessarily talking about not using those tools. Those can actually help to facilitate gentle handling. So let's watch a little bit. So I didn't have a large dog to demo. So when we get into the small dogs and cats, that's when we'll be able to use our stuffed animals. But here's some videos that Dot made to show just a couple of large dog gentle handling techniques in action. So you can see using your body in a wall to help access the hind leg. This would be for sort of like a blood draw, like a heartworm test. So using your body wisely. So this is just as an example. Obviously, I think we could go into more depth about the exact how, but just an example of sort of using your body wisely in terms of how you can handle the large dogs. Here's an example of distraction. This could become sort of counter conditioning if this was done repeatedly, to give an intranasal vaccination, which is another thing that we have to do with our dogs and is never, can be a challenge. And so this is one way that can be accomplished for the right dog that responds to a food motivator. But so I put those up there as examples. Obviously, this is an exhaustive tutorial, but you can see a little bit of those techniques in action. So we'll circle back to some tips and tricks, but let's talk a little bit about our cats and our small dogs. With the caveat that small dogs actually sometimes can go either way. Sometimes small dogs, you're using some of those more big dog techniques depending on their personality. Sometimes you're using more of your techniques that might apply more to a cat depending on their personality, their size. But generally when we're talking our smaller creatures, a lot of it, so we're talking animals now that we're putting on a surface to do stuff, usually. Usually we're not doing these animals on the floor, whereas our large dogs we're usually doing on the floor. So when we're putting an animal on a surface to do anything to it, that surface is really critical. A bare stainless steel surface is incredibly counterproductive. That's scary. It's cold, it's slippery. Yes, it can be easily disinfected, and it's great in that regard, but putting something on top of it can make a huge difference for these animals. Again, towels, and more towels are really useful, and so towels can be, we'll talk a little bit about that, but they're also something that can be donated. Towels, it's a pretty thing to readily get as a donation. One of these towels was inadvertently donated by the Marriott this morning. I will bring it back, but hotels, in all seriousness, can be a source of donations. Not stealing them like I did, but actually getting them donated. I will bring it back, I will. Also, the other thing that towels can do is facilitate hiding. So some of these animals don't want to hide. Some of them are really friendly, outgoing cats that want to see what's happening. It's happy little dogs like the one in the picture that want to see what's going on, but a lot of them aren't. They're terrified. They don't know where they are. They want to hide, and that helps to reduce that negative stimuli and to make them less stressed, and so facilitate that for them. So whether that's two towels, one on the table, one over top of them, whether that's a towel that's sort of wrapped around them, we'll do a little bit of demoing of towel techniques, but facilitating hiding for them. These guys are huge. Minimizing the external stressors and the negative stimuli applies across the board. Just because our big goofy dogs are being big goofy dogs doesn't mean they aren't scared of stuff. They aren't scared of other dogs barking. So it's not to minimize that aspect of their stress, but I think we see it even more acutely for these animals. And we're talking about cats and dogs, but once we start to get in, like if you're handling rabbits, the small animals, this certainly applies for them as well. It's scary to have dogs barking, to have things banging. So it's really critical for these guys. Believe it or not, food. Cats will actually, at a much higher rate than you think, like food as a distraction. Spray cheese is like the best thing for gentle handling. If you come away from this lecture with two things, it's towels and spray cheese. Spray cheese occurs across the board. Dogs like it. Cats actually really like it. But so there are certain things, and cat food and treats and that sort of thing too. But even for your scared cats, it is worth trying for animals that you don't necessarily think it would be working for. Your scared little dogs, your scared cats. Some of them will surprise you by taking food and you being able to use food as a distractor, even though it isn't something that we necessarily think naturally for them. So before we move on, we'll circle back to, I don't have videos for these guys because we're going to do a little bit of it, and I'll try to make sure I'm running a little over what I'd planned, but I'll try to make sure there's at least 5-10 minutes at the end to demo and for you guys to practice if you want. The elephant in the room with cats is whether to scruff them. That's how I was taught to handle cats when I went through vet school and when I worked as a veterinary technician. I think that's how many of us were taught, especially those of you that aren't brand new to the field. That's what you were taught to do, is to scruff cats. So the question is there ever a role for scruffing? And my answer to that is mostly no. She's not here in this lecture hall, but she's actually here at this conference as a technician that I've worked with to provide one example of a scenario where I think it was actually appropriate. I did a rabies clinic back in the spring, just volunteering for the city of Boston. And we weren't as prepared as we should have been for cats. So we'll talk about preparation. I think it could still have been avoided, but in the moment, we had a cat that was there for a rabies vaccine. We had taken some precautions. The doors were closed. There weren't dogs in the room, but it was a pretty big room. We were at like a community center. It wasn't a great environment, and we had a cat that we pulled out of the carrier to get the rabies vaccine, and he started to bolt. And in that scenario, she just grabbed him real quick by the scruff, put him back in the carrier. We had him facing the right way. They gave him vaccine. He was done. I think that was probably actually the best call for that cat in the moment. It's an owned cat. It's going back to its owner. It's going back to its home. It's not a cat that we're housing for a long time in our shelter that we have to work with. It was ultimately trying to chase that cat around the room would have been really stressful. So I don't want to come out and say there's never a role for scruffing, but there's almost never a role for scruffing. You can really get to where it feels awkward and wrong to scruff a cat once you get really proficient with some other gentle handling techniques. But it's really hard to teach an old dog new tricks, and so I say that with the caveat that it took me a long time when I was learning this stuff to get there. So let's talk some tips and tricks that apply across the board, and I'll kind of go through these relatively quickly so that everybody can get a chance to try some cat stuff on my demo models. So tips and tricks. Have your supplies readily available. And I think this comes into the efficiency thing a lot. This is not going to be the most efficient technique if it's the ACO comes in with the animal. They're like, okay, we're going to do gentle handling. Like, where's the peanut butter's in the kitchen. Okay, I got to go get the kitchen. Like, here, let me give them this. Like, oh, shoot, like we should get a muzzle. Like, let me go over here and get the muzzle, blah, blah, blah. And so that's going to make it take long. And then you're not going to get buy-in from everybody that you're working with if things aren't at the ready. And it's going to take a little bit of if you're newly implementing these things, it takes a little bit of trial and error. You're going to forget things. But the more you have things readily available, the easier this is. So certainly treats and food options. I mentioned spray cheese is like your savior. It applies across the board. Peanut butter is great too. Be careful with people that have allergies. That can be a problem with peanut butter, but obviously it's great, particularly for the dogs. Treats, canned food, have those things readily available so they're right there. So it's not a barrier to using those. Towels everywhere. Like I said, they're readily donated. We had a partnership when I was at the ARL where the municipal shelter did not get them readily donated for a variety of Boston-related stuff. Boston's not the easiest city always to work with from the city government standpoint. But there was, at the ARL, we had more towels than we actually needed. So we actually would take some of the ones that were donated to us and bring them to the municipal shelter. So even if it's a matter of partnership, you can get towels. And then have your stuff that you've traditionally had, your muzzles, your protective gloves. These tools that we've been using for decades still apply. We can still use them and we can still need them. So have those readily available too. Plan ahead. So when you can. Sometimes the intake comes in, the thing needs to happen, and it's right there, and you're dealing with it then. But if, say, you have a dog that comes in via intake, and it's terrified, and it's scary, and it's not safe, oftentimes you can get a quick distemper vaccine in, you get the critical stuff done, but then you need to circle back to get the dewormers, to get the heartworm test, to get an intake exam. You might need to circle back with that. So in that scenario, then okay, let's regroup and plan ahead. Let's decide where we're going to do this. It might be that this animal's been in your shelter for a little while and you have to do something with it. And they love the outdoor run. That's where they're more comfortable. And you can do stuff safely in the outdoor run. Think about what location makes sense from all of the stuff we talked about with reducing negative stimuli. Come up with a strategy and come up with a backup plan for what to do if it doesn't work. Renee, with the sunglasses on her head in that photo, is with our Behavior Rehab Center for the ASPCA, and they do this retreat for shelters, and I've set in on it as kind of consulting on the shelter medicine stuff, but they do a demo of low-stress medical handling, and one of the key things they talk about, and they have really, really fearful dogs, that's who they're rehabilitating, so it's a challenging population to work with, and one of the things they really emphasize is that communication ahead of time and during. So if you're doing it with multiple people, if there's two of you, talk about what's happening. Talk in a quiet, calm tone, remember negative stimuli, but talk. through it. Like, I'm noticing that he's getting really tense. Like, I think you should stop this. Or let's regroup. Or on the flip side, if they're not fearful, but they're crazy, like, okay, let's regroup. We're struggling to try to get this heartworm test and things aren't working. Like, let's talk about this and let's come up with our backup plan. And along those lines, avoid escalation. It's easier said than done, but when you get into a scenario where everyone is starting, where the animal is starting to struggle, and you're having to use more force, it's just going to spiral in a negative direction. Because I know, at least for me, if I'm kind of wrestling with an animal trying to get something done, I'm getting amped up too. So everybody's getting amped up. And it's just, even though it feels like it's what's going to be quickest, because you just want to get it done, ultimately it's going to take you more time. And if you just put that animal, either put it back or stop and regroup, it really will take less time in the end. And sometimes that means prioritizing what's important. It might be that this dog's coming in intake, like you need to get the scanner done because it's a stray and you need to find out if it has a microchip, and that's important. And I'm a shelter veterinarian, it's important to get the distemper vaccine in there. That's important. But okay, maybe we can wait. Like, let's say this is starting to go south. Like, we can wait on the heartworm test. We can wait on, honestly, sometimes even putting on a topical treatment can be scary. We can wait on that. We can wait on doing the exam. Decide what you can wait on. And don't be afraid to postpone it. Again, it feels, I'm a check off the to-do list kind of person, and I hate doing that, but it is better in the long run, and it is quicker in the long run, as long as you're planning out your day. I said I would circle back to this at the beginning, and I want to circle back to it. And I know I'm not talking to a veterinarian audience today, and so to some extent, as staff and volunteers, your use of sedation is reliant on being able to have that prescription for you to use. But you should definitely be advocates for the animals in your care. And veterinarians are becoming more and more comfortable with using sedation. But don't be afraid to broach this topic with either your staff veterinarian or the veterinarian that you partner with, because I think sedation is oftentimes safer than struggling. This conversation comes up in a lot of different scenarios. But again, I have a 14-year-old cat who was bad at the veterinarian because I was a bad owner when he was young and I didn't, desensitize. I knew all the things I should do. And so I will very, very happily give him gabapentin, and I would give him more if he needed to, because even though he is a 14-year-old cat with heart disease and kidney disease and constipation and blah, 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 he's got all this stuff going on. Ultimately, proper sedation, safe sedation, is safer for him and safer for most of our animals than getting really wound up. That has its own negative sequela. And so sedation, as I said, it's a prescription. It needs a veterinarian. It needs to be part of a veterinary client-patient relationship. That doesn't mean, though, if you are at a shelter where you don't have a staff veterinarian, or where that staff veterinarian can't just be at the ready all the time, that you can't have protocols set up. The veterinarian can help to set up protocols, like we're going to give cats at intake gabapentin if they show X, Y, and Z signs. We're going to give dogs trazodone if they show X, Y, and Z signs of kennel stress. There are some really good, safe sedatives or anxiolytics that reduce anxiety that we have right now at our disposal that can be set up. So conversation to have, if you don't have that sort of thing already, it's a conversation to have with the veterinarian that is working with your shelter or rescue. My last tips and trick is that, so if you're in a position where either you're learning it yourself for the first time to do some of these gentle handling techniques, or you're helping to implement it at your shelter or rescue, just remember it does take some time. Like, it won't be as efficient initially, but you'll get there. I think you need to be patient, but as somebody that was sort of trained, and then I kind of passed it forward, both in this context, but also with some of the staff. Staff would, if I was going to do something with an animal, they would go to scruff the cat, or they would go to just kind of, and it just took patience with that, but gentle, oh, no, remember, we're using this towel. And so I think that no matter what your role is, be an advocate for using these techniques, be consistent with it, because that's how you'll learn, but also be forgiving of yourself and your colleagues, because it takes a little bit of time. And so just being consistent, but patient. The two main programs that you can learn more from about this, Fear Free is the biggest one. Fear Free, I guess an affiliation with Maddie's, right, I think. But so their initial program is geared towards veterinarians and private practitioners. It in and of itself has applicability to shelters and to shelter staff and to shelter volunteers, but they are coming out with the shelter program. And I don't, Dot, do you know if it's out yet? Okay. I think it's supposed to be free too. So it is all online. So that makes it good and bad. Like, so it's all online, so you're not going to necessarily do the hands-on stuff, but it's easier to accomplish because you don't have to go somewhere to do it. It's online. It's pretty. I'm certified through the one that they have that is geared towards private practitioners. I think it's like 8 hours total of lectures, maybe a little faster if you cheat and skip some of the beginning once in a while. But it's a really valuable kind of approach, and it really gets some of it the specific techniques, but also reinforcing some of the background. Low stress handling is Dr. Sophia Yin, who has unfortunately since passed away, but it's her program that is still available, and that is, it's not free to get certified. I think at least a few years ago it was like about $300. But it's a very valuable program. And they have different pros and cons. From my kind of secondhand experience hearing about it and from having done the fear-free, I think the fear-free gets a little bit into the practical techniques, but it's a really strong basis in the why. I think the low-stress handling probably delves a little bit more into the practical techniques, but again, it's more expensive and maybe a little less robust on the why and the science behind it. All right, so without further ado, let's address these creatures up front. So we're going to do just a very, very limited demo, and I realize that I am mic'd, and so hopefully this doesn't create a horrible problem. I'm going to have their creatures donated. Obviously, they are not all actually cats. But if you do come up, this session is being recorded, so you will be on the video. So we'll all be up here. It'll be okay. But just if you feel uncomfortable with that, obviously, just so that way you know. All right, so let's talk cats. I'm going to see if I can do this without. I didn't actually plan ahead to pick which one was going to be my demo model, but I'm going to pick Fang, even though he's a dog, but he's my daughter's. So we're going to go through 3 techniques. So ways that I might actually do these in a different order. So if you're approaching a cat, a nice way to do a gentle handling technique of carrying a cat, sort of. So if you have to bring your cat from point A to point B, a nice way to carry it, a nice way to do the exam, and then some tips and tricks for venipuncture. So if you're holding a cat for retroviral test or other blood draws. Let's see if I can do this. So I use my body a lot. So I'm going to try to keep the mics on, but apologies in advance if it creates some sort of horrible noise for everybody. So again, towels are your friend. So you want to have a towel handy. It seems like it would be scary to go in. So if the cat's in an enclosure, so here's Fang sitting in his enclosure. It seems like it would be scary, but if you approach in a nice, calm manner, and this is a great tool for food. So if I had some treats with me, putting them in the cage so that if he's kind of eating his treats and not even paying attention, that even further helps to facilitate it. But even if he's sort of cowering at the back, if he's under a corunda bed and he's hiding, or if there's a box, that he's kind of hiding behind, you can still do it. So you're basically just kind of coming in, and so you're putting the towel over them. So it's going to depend on your cat. In my personal experience, and this is all just coming from my experience. I learned stuff and then I've tweaked it kind of based on what seems to work for me. I find for most cats that are scared, you're actually going to cover their head. And so then you are so it's a lot of use of your body. We talked about with the dogs, but it applies with the cats too. So you've got your elbows right here. So if this is I'm short, but you can still kind of do it in an upper cage. Sometimes it requires a little bit of height support with the stool or whatnot. So you're taking your elbows. So I've got the cat's legs controlled with my elbows and with this hand. And so I'm kind of squeezing to pick up so that the towel comes underneath. And then if I have to carry him, he's a boy, through somewhere, then I can go like this. I'll hold him like this and just carry along. And it actually works like gangbusters. So especially if you've got if you've got squirmy cats, if you've got cats from like a hoarding situation that are under-socialized, this can be a great tool because you have a lot of control. So my hands are underneath the feet, and then I've got my arm here. So if he were really happy and friendly and outgoing, then I might do this. And so I've got the towel in front, so I still have that leg control, but especially if I didn't have to walk through a hallway or if I didn't have to walk through, we all have imperfect shelters, right? So even though we shouldn't have any dogs around, there might be. So, but if I didn't have to do any of that, then I can easily just do this and have the head out and go willy-nilly. And some you'll get a read. Some cats, you get a read if they're particularly friendly from the start. And if they're friendly and you start to cover their head and they start to squirm more, you'll see if they actually feel less squirmy and more comfortable. And this is basically the same. You can then transfer this right away into an exam. So if I'm doing an exam, and this would apply whether, again, I'm a veterinarian, so I keep falling back into sort of veterinary talk and language, but it applies if it's your intake exam. It doesn't have to be a veterinary exam. Or if you need to do vaccines, then you can have them, and you can even just use one towel, because you've got this towel sort of underneath too, as you're doing your exam, and then you just sort of lift up the part that you need. So if I needed to look at the face and the eyes, I've got them right there. If I needed to give a vaccine, I'm keeping the hand covered, the head covered, I've got my hand on the head to provide some control, not scruffing, just keeping gentle pressure. I've got the arm. If I needed to help the kind of veterinarian give the rabies vaccine, I can get the back end right there. And then if I've got this position and I need to do a blood draw from a back leg, what I can do is use the same towel, wrap it underneath, and this is a little bit low, but you can still do it. Then what I'm doing is I've got the towel all the way around, and again, same thing. Depending on the cat, sometimes having the head covered is more comfortable. Sometimes having the head out is more comfortable. And this is where you can use food if you've got a very food-motivated cat. But I've got my arm all the way around, and I've got the front legs tucked up under this. I don't physically have it for Fang because he's a sitting stuffed animal. But then I can take this, unwrap it, and then have the back leg right here. And you'll be shocked at how many cats respond so well to that you didn't think that we're going to be really squirmy for a blood draw. And then if I was going to do a front leg, which actually front legs in cats, I'm a little bit of a convert. I was always used to the back legs, and so that's what I'm used to. But you can use the same technique, especially so if you've got a really fractious cat. If I'm doing this, I've got the head covered, I've got the other arm, I've got this tucked around the back, and you can do a better job of even burritoing them, so you've got this all the way around the back. So I've just got this front leg exposed. And not that I'm necessarily advocating for everybody doing things by themselves, but sometimes realistically you're by yourself, sometimes trying to get stuff done. So I have actually done front leg blood draws completely on my own, using this technique if I've got them wrapped up really well and it's a cat that I feel like, that I feel comfortable doing that, just holding off with my hand and doing it like that. And if you are in a setting where you're holding for a jugular, you can use the same thing, cover the front legs, and even if you've got a fractious cat, you can also use a kitty muzzle to help you with that. You can hold that up like that. So a towel can really go a long way, and it is, especially with the use of, if you've got a really fractious or scared cat, and you're using some gabapentin or something just to take the edge off, you can really, it's very few and far between the cats that need full sedation with this. Yeah, go ahead.
Would you recommend that technique for cutting claws on cats?
Yes. So that same front, I'm glad you brought that up, that same kind of front leg, perfect for that. And the same jugular, if you've got to give a medication. I did this for my own cat when he needed medication. You've got the head free, and you've got every other part controlled. And I didn't really get into small dogs. I'll be perfectly honest. I feel much more comfortable with cat handling than I do with dog handling. A lot of the same thing apply to small dogs. You can certainly use towels. There's other techniques too that can be implemented that I won't get into for reasons of time. And let me see so we're right at time, unfortunately. I want to have everybody, I know maybe during the break while Dr. Datar is getting set up, but I think just so that everybody can come down, I might just take questions down at the front if everybody's okay. But feel free to come down, play with some stuffed animals if you'd like.